Setting: pre-surgery clinic. You see a 60-year-old patient who is going to have an operation on his or her knee this week. He or she attends the clinic for a preoperative assessment and wants more information about the MRSA, Methicillin-Resistant Staphylococcus aureus screening. Now, let's see the task. First one says, confirm the reason for the patient's appointment, preoperative assessment before knee operation. Second one says, find out if the patient has any questions. Third one says, give information about MRSA, common skin nasal bacteria, resistant to antibiotics, harmless to healthy people, causes complications for surgery and recovery. Fourth one says, describe purpose of MRSA screening, infection control in hospitals. Fifth one says, outline procedures for MRSA screening, swab from nose or groin, sent to laboratory for testing. Result within a few days. Find out if any other concerns. Sixth one says, explain the next if result is positive. Prescription for antiseptic body wash, extra hygiene measures, ointment for nostrils, 5 days retest, etc. Seventh one says, reassure patient about precautionary measures to prevent spread of bacteria, strict cleaning regime, antibacterial hand wash, sterilization of equipment, monitoring of facilities. The last one says, establish patient's consent to have screening. Now, let's begin the role play. Hi, good morning. My name is Laura, one of the nurses in this pre-surgery clinic. May I know your name and age for verification?
Good morning, Laura. My name is Sophie and I'm 60 years old.
Hi, Sophie. Can you please confirm the reason behind your appointment?
Nurse, I've been asked to get tested for MRSA.
Thank you for the confirmation. I understand that you're here for a pre-operative assessment before your knee operation this week. Am I right, Sophie?
Yes, nurse. That's right.
Okay, Sophie. Before beginning the assessment, any questions to be clarified?
Yes, nurse. I'm a little confused about the MRSA screening. I know that I need to get tested. However, I don't really understand why it is important.
I acknowledge your concern, Sophie. Let me explain to you why the MRSA is important. First of all, MRSA stands for Methicillin-Resistant Staphylococcus aureus. It is a type of bacteria that has developed resistance to many commonly used antibiotics, including methicillin and other penicillin-like antibiotics. This resistance makes MRSA infections more difficult to treat, as these antibiotics are less effective against the bacteria. Moreover, it can cause a wide range of infections, including skin infections, respiratory infections, and bloodstream infections. Okay, Sophie, I hope you're following me.
Yes, nurse. Please continue.
MRSA is commonly found on the skin and in the nose. However, it usually doesn't cause any problems to healthy people. Nevertheless, if they enter the body through a wound or a medical device, they can cause serious problems, and also it can potentially spread into the other people. I hope you are following me.
That's great, nurse. Now, may I understand the importance of the screening?
Your concerns are reasonable, Sophie. Let me explain to you in detail. The purpose of MRSA screening is to prevent the spread of MRSA infection in hospitals, where people are more vulnerable to infections. By identifying people who are carrying MRSA, we can take precautions to avoid transmitting the bacteria to staff. MRSA screening can also help to reduce the risk of complications and improve patient recovery. I hope you're with me.
Yes, nurse. May I know what the screening involves?
Okay, Sophie. MRSA screening refers to the process of testing individuals for the presence of MRSA bacteria on or within their bodies. Screening is typically done in healthcare settings such as hospitals to identify individuals who may be carriers of MRSA or who are at an increased risk of MRSA infections. The test involves taking a swab from the nostrils, wound, or other body parts like buttocks or groin and sending to the laboratory for analysis. The results will be available within few days. The aim of MRSA screening is to prevent the spread of the bacteria and implement infection control measures when necessary. Okay, Sophie, I hope you're clear now.
Yes, nurse, I understand it now. But what if the test confirms that I have MRSA?
Sophie, I understand your perspective. If your test is positive, we will prescribe an antiseptic body wash and ointment for your nostrils. We will also ask you to take some extra hygiene measures such as washing your hands frequently and avoiding contact with other people for the next 5 days. Once you have completed the treatment, we will retest you to make sure that you are free of MRSA.
Do we have any preventive measures in place to control MRSA in hospitals?
Preventing the spread of MRSA involves good hygiene practices such as frequent hand washing, keeping wounds clean and covered, and avoiding contact with other people's wound or personal items. In hospitals, infection control measures, including isolation and strict hygiene protocols, are used to prevent the spread of MRSA. If your second test is negative, you'll be able to have your surgery as planned.
That's fine. By the way, even if my test is negative, now I'm a little worried about picking up MRSA in the hospital. Could that delay my surgery?
Your concern is natural, Sophie, but it is unlikely to get the infections in the hospital, so don't be panic. We take strict precautions to prevent the spread of MRSA in the hospital. For instance, we have the best infection control procedures. That is, we have a rigorous cleaning and sterilization regime. So we do the antibacterial hand wash frequently. Along with that, we make sure to do the sterilization of equipment before each and every procedures. Apart from that, we are constantly monitoring our facilities as part of infection control and to provide a better and safer environment for the patients. Do you have any more questions to be clarified?
No, nurse, thank you. Moreover, I'm feeling a lot better about it now. I'm happy to have the screening.
Glad to know that, Sophie. Can I have your consent to have the screening now?
Sure, nurse, please.
Do you mind taking a few swabs from your nose and groin so that I can send them to the laboratory and we should receive the result within a few days?
Okay, nurse, please go ahead.
Thank you, Sophie. Now let me recap what we have discussed until now. So far, we have discussed about the preoperative assessment and importance of MRSA screening before your surgery. I hope you understand that. Please be relaxed here. I'm going to take the swabs from your nose and groin to send to the laboratory. Meanwhile, if you have any concerns, you can ask me. I will be glad to help you. Thank you, Sophie, for your kind cooperation and understanding. I wish you a speedy recovery.
Thank you, nurse. Thank you so much for your support.
Thank you all. Our role play ends here.